first instrument is the scalpel blade handle. It accepts all of the standard scalpel blades, such as the 15, the 15C, and the number 11 blade. This instrument is in a pen handle, which allows us to get greater control, greater leverage, and more precision when making our incisions. It allows us to apply the pressure that's necessary, as well as it allows us to rotate to take into account the curvature that we find in the mouth. Using the scalpel handle with a number 15 blade, I'm going to make 2 vertical release incisions. The first incision is going to start just above the mucogingival junction. I'm cutting boldly all the way down to the bone, and I'm going to end with a stab incision right at the front of the tooth. The second vertical release incision is going to start above the mucogingival junction, and it's going to cut boldly down to the bone, ending at the rear of the tooth. This is the Cindex periosteal elevator, very useful in peeling the soft tissues, the gingiva, mucosa, and periosteum away from the tooth and away from the bone. There's a small end and a large end to allow for use in smaller, tighter areas to get the flap started, and then to continue elevation on with the larger size. It's rounded on the end, so there are no sharp points to prevent perforation. Also, it has a gentle curve to it to keep the blade on the bone the entire time while we're using it. And finally, it has a very thin cross section here, allowing us to provide easier, faster sharpening so that we can keep this instrument, the Cindex periosteal elevator, nice and sharp all the time and get the maximum use out of it. Now, using the Cindex periosteal elevator, I'll take the blade and begin by peeling the corners back from the front of the tooth and from the back of the tooth. You can also peel some of the soft tissues coming down from the crown toward the root, but only for 1 millimeter or 2 until we get to the alveolar crest. Now what I'll do is I'll come with the blade from either the front or the rear of the tooth. I need to make sure that the blade stays on the bone the entire time as I work my way across here. I'm taking my time with this instrument to keep the blade always on the bone. Taking my time, working my way across, freeing of this tissue, preventing perforation either at the mucogingival junction or ripping the flap near the alveolar crest. Working my way across, and then going a little bit further beyond the mucogingival junction to gently pry this tissue away, to end up with this, which is just denuded bone. I'll then go on the other side of the incisions to peel back the soft tissues there for 1 millimeter or 2 so that I can get a good bite with my suture material. And then finally, I'll come around the palatal side of the canine tooth, prying the tissues there to get things started.